they often will end up with angina because they're not getting enough blood flow. And those widened pulse pressures we talked about. That's it. Any questions?
It's not so much a question. I just have to go back. I made a couple of notes and I need to reread it. If I have any, I can email you like a lump sum of like 3 or 4 questions that I have.
Why don't you ask them? They're here.
Well, I
Because
don't
you know what? If you have a question, how much do you want to bet that half the people will say that?
Well, you had talked about the ventricular curve, function curve.
Yeah.
And you had said like the increased pressure in the ventricles equals the increased volume. Is that right?
Output.
Increased output.
So when the farther the ventricle can stretch, the greater amount of blood's going to be in there.
Okay.
And like the elastic in our pants, the farther I stretch out the elastic, the more squeeze it's going to have, the more it's going to bounce back, all right? So if I stretch a decent amount, when I squeeze back, I'm going to get more bang for the buck.
Okay.
All right? So that's what that curve has to do with. It has to do with your left ventricular output, or right ventricle output too. But the left ventricle is the one that pumps all the blood out.
Basically, the flexibility that you have, or the span
Yep.
that you have in your output, you can go for either from here to here. Your range in output, basically.
There's a change, there's a variability in range, and remember that as we become older, vessels become more stiff.
So
you end up with diastolic dysfunction, which means that the heart muscle and the fibers don't relax as much, and so they don't have as much time to be able to rest and get that blood flow. They don't dilate as much, they don't stretch as much, they don't relax as much. That's problems with diastole. Systole is when they don't squeeze enough.
Right.
Okay, and that could be from, when they become, if you get hypertrophy, we talked about how the vessels become thicker and the wall becomes thicker. So if it's thicker, it's not going to be able to expand as much, so that when it goes to squeeze, it's not going to be able to squeeze as well because it doesn't have as much elasticity.
All right. My next question, so there's 3 questions. So then the other one on contractility.
Yeah.
You said positive inotropic medications gives a better squeeze.
The inotrope has to do with squeezing. So if you want to increase the inotropy, you want to squeeze more. So a beta blocker is a positive inotropic drug. It affects the muscle fibers so that they have more contractility.
But digoxin is not inotropic. But
Digoxin is also inotropic,
Okay.
but it doesn't affect blood pressure. Whereas your beta blockers affect your blood pressure.
Okay. All right. That's that one.
All right. Good
So-
girl. No,
These
sorry.
are helpful. I'm writing everything
No,
down.
don't worry about
Yeah.
it. I'm telling you. I was the worst. They hated me when I was in my associate's program because I raised my hand about everything. And I used to say, I'm paying for my education, mom and dad aren't putting me through school, and if I have these questions, half the kids in the class did. And half the kids in the class did, so you know what, I just was a pain in the neck. So there's no such thing as a stupid question asking.
Okay, so then on the afterload, you had said increased BP leads to increased ventricular size and the radius of hypertrophy.
Now, do you understand why?
What I wrote was, and I don't know if I got the full thing, it said too much left ventricular hypertrophy causes a backlog of pressure. Is that right or no?
No, well, no. If we think about the heart,
Afterload is essentially your blood pressure.
afterload has to do with your pressure. So if you have a high systemic blood pressure, that means that poor ventricle is pushing blood out through the aorta to pipes that are tight.
Okay.
Oh.
So that it's got a backlog of pressure. It's working really hard to push that blood out because you have backload pressure. Okay, so those pipes are tight. And so that ventricle says, I'm not strong enough. I'm going to get thicker so that I can create more tension and get more blood out. Well, initially, that hypertrophy is okay because it hasn't reduced the chamber size. But if you continue to have that hypertension and that increased afterload, what's going to happen is that ventricle is going to get so thick, the chamber is going to get smaller.
Okay. So
And then the output is decreased because the ventricular size is smaller. because it's gotten thicker. The wall's
So
gotten too thick.
over time, if there's increased pressure, it thickens the ventricle, which gives less.
Less blood flow because the chamber itself actually becomes too small.
Okay.
Because hypertrophy means that we make more cells. Remember, when we learned, and that's why we do the cellular stuff first, to understand the difference between atrophy, hypertrophy. Atrophy means that the cell's shrinking, get smaller. Hypertrophy means the cells get bigger, okay? So that if your cells are bigger, they're gonna take up more space, right? The wall's gonna get thicker. If I have bigger stones to build a stone wall with, the stone wall's gonna be bigger. But if I build a stone wall too much, I'm gonna start encroaching on my next door neighbor's property. And their lot's gonna get smaller, and they're not gonna be very happy with me. So when you get too much hypertrophy, you're eventually gonna end up with a decreased chamber size. And when the chamber size decreases not enough, you end up with a decreased ejection fraction.
Because the thickness is pushing in on the size of the.
Because
so
the
it's
thickness
closing it
goes
in.
this
Okay.
way, not this way. When the wall gets thick, it doesn't get big, it doesn't dilate, it goes this way.
Okay.
Does that make sense?
Yep. And then my last one was under complications of MI. You had given two other markers. You said a calcium is usually, when we check levels or whatever, calcium is usually at a 4, you said?
No.
You want a calcium level at a 4?
When we look at somebody who has a
No,
heart
yeah,
attack,
that's
one
right.
of the things that we look at in addition to a troponin is we always worry about their electrolyte balance.
Okay.
In cardiac patients, I want their potassium at about 4.
Okay.
Even though 3.5 is considered low normal, if they've got heart stuff, I want them up around 4.
There was another one you also said.
Magnesium.
Magnesium. That's what it
Magnesium
was.
should be 2.0.
2.0?
1.9 is considered normal.
Okay.
But we always, and years ago, we never looked at the mag. And now we know that magnesium and potassium are very important to heart muscle function. So that having enough of those electrolytes is important for the heart. So those are the two things.
And when they're low, if someone's having some sort of, you end up replacing
Oh,
them
yeah.
along the, okay.
Yep, I replete them. If somebody comes into the hospital, and I swear to God, the Cape sucks magnesium out of people. Everybody I know comes in with a mag of like 1.7. And I give them 3 grams of Mag IV right away, unless they're in failure, you know, and then I'll have them concentrated and have them take some Heal Mag, but I get their Mag right up. So Mag and potassium.
Those are my questions.
Perfect, good job. Any
So
other
why
questions?
does the Cape suck with the mag?
I don't know, I joke that it's the water, I swear to God, because, I mean, I can't believe how many people are hypomagnesiemic. The other thing is too, is I'll always ask them, do you have leg cramps? Because leg cramps are either because they're potassium low or magnesium low, usually bad.
Do you think it has, I noticed that we have, I mean, I know this is kids, but we actually have a lot of adult patients now. A lot of CF adult patients are all from the Cape. And they all crave salt because, and I always wonder if it's because they're close to, I mean, if there are, but
I
like
have to wonder.
9 times out of 10, every patient that comes in, or that's every adult patient that has CF that's followed through from a child on, they're all from the Cape. Either they moved down there at some point, or they were from there.
Somebody needs to do a study on
I
it.
know,
We have-
right?
I
We
just wonder
very high
if the
cancer
sodium,
rates,
if the
too.
salt in the air is
In the
like
outer
sucking
Cape.
other things
Oh, I
out.
know, it's, the cancer rates are high.
There was a huge fight in Eastham to get town water because people have been for 50, 60, 70 years just throwing car batteries in the woods.
I
And
live
we
in
have a
Nashville,
very
we
high-
had the
We have a
dumping
very high water
zone
table.
out at that.
Yeah, we have a very high water table because we're on sand. Plymouth is
And
very
everything
similar.
everything can leach right into those water tables.
They
It's
were,
huge.
the towns were fighting having water, random well testing and stuff done because what they were gonna
Well,
find.
it's money,
Yep.
big money to do all that stuff. So, and the father, and getting the water to you is another big deal. Yeah, it's a big deal. All right, can you turn that button off?
Oh, yes. I don't know.
She didn't know which one it is.